Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
Well, the shoulder is a little bit of a unique joint in that it's not quite the same as a hip or a knee. It's probably most similar to a hip in that it is generally a ball and socket joint, but the socket is very shallow when you compare a shoulder to a hip. A hip has a very deep socket and a shoulder has a very shallow socket. Shoulder arthritis does occur, but it's much less common than hip or knee or even hand arthritis. Because I do specialize in shoulder surgery, I tend to see a lot of people who have it. I think a lot of it is genetic based. Some of it has to do with people who have had prior surgery, and other people have had prior trauma, maybe some type of fracture or a dislocation, which leads them to get arthritis. When they get bad arthritis, there is something called a shoulder replacement, which generally is very effective at alleviating people's pains, and much like a knee replacement or a hip replacement, basically it involves removing the articular surfaces and replacing on the arm side a pin that gets basically tapped into position, and then a metal ball that goes on top of that, which replaces the arm side of the shoulder joint. And on the socket side, generally we just place a small piece of plastic that replaces the cartilage on that side, and so you have metal and plastic just like you would with any other type of replacement. The main difference between a partial replacement or a hemiarthroplasty and a full or total shoulder replacement is that in a partial replacement we're only replacing the arthritic surface of the arm or the humeral side of the joint, whereas in a total shoulder we replace the arm or the humeral side as well as the socket side or the glenoid side. People who may be a candidate to have just a partial replacement are generally people who, or patients who are much younger, maybe in their 40s or 50s, that have arthritis in their shoulder, or maybe who's somebody much older in their 80s or 90s who cannot support some, because of bone stock issues on the glenoid side, they may not be able to support a full replacement. And there's other issues that could come into play with people who have fractures are generally good candidates for a partial replacement. People who have arthritis, for the most part, are generally candidates to have a full or total shoulder replacement. The recovery after a shoulder replacement, whether it be a partial replacement or a full replacement, generally the recovery is the same for both of those surgeries. And it's gotten much better, as I've discussed before. We've gotten much better at controlling the pain. Generally the patient will come in for their surgery. They'll meet with the anesthesiologist, and generally we perform the surgery under a regional block where they basically give you a shot in the neck region, which numbs the nerves to the arm and lasts for about 12 hours after the surgery, so it's very effective at controlling pain after the surgery. You have the surgery, which generally takes a couple of hours, and you wake up in a sling. And patients are generally in a sling somewhere between 3 to 6 weeks on average. And we send you to physical therapy beginning on post-op day 1, and generally you need physical therapy for around 3 months after a shoulder replacement. And most patients are very happy after the first couple of weeks and able to lift a cup of coffee and brush their teeth, brush their hair, and do basic activities of daily living. And then as the repair heals, I generally will let them do more activities, and activities such as golf I usually have them avoid for the first 6 months. A reverse total shoulder replacement is a little bit of a different type of surgery, and it's indicated only for one particular type of arthritis in the shoulder, and that is somebody who does not have a rotator cuff anymore. And the rotator cuff is a group of 4 muscles which surrounds the top of the arm bone and allows it to function normally. For somebody who's had a tear for a long period of time and the tendon has retracted and is no longer able to be repaired, if they have arthritis and are no longer able to lift their shoulder, then they'd be a good candidate for a reverse shoulder replacement. And what that does is actually switch the ball and socket and reverse their position. And by doing so, you allow some other muscles on the outside part of the shoulder to lift the arm and replace the rotator cuff.
For more information, visit us online at conwaymedicalcenter.com.